Let's journey into the unexplained with 5 shocking medical mysteries. We'll start with the girl who cries stones. In 2014, 12-year-old Saadiya Saleh from Yemen bewildered doctors and struck fear in local natives with her condition that causes her to cry stones. The stones form from under her eyelids and are pushed from underneath to fall out, which sounds like it'd be quite painful. Can you imagine the stones scraping your eyelids as they fall out? The girl is not suffering from any known disease, and doctors could provide no explanation at all. People in the young girl's village are terrified Saadiya may be cursed or possessed by the devil, which obviously would cause a panic in the people nearby. Oddly enough, Saadiya has not been the only person reported to suffer this condition called crying stones. Reportedly in China, there's a case of a woman who's also experienced the stone forming underneath her eyes. For the last 13 years, Natalie Adler has suffered with a condition that causes her to close her eyes for days at a time, unable to open them. Natalie's eyes become swollen and clamped shut, leaving her hopeless and unable to see. Not only is she unable to see, but during the occurrence she feels pain throughout her entire body and suffers from constant nausea.
They just developed into this random cycle where they would close for spasm shut for 3 days and then open for 3 days.
Despite there being no medical reason why Natalie's eyes become clenched shut, she has underwent multiple surgeries, including Botox injection. Baffled, some doctors say Natalie's condition is a psychological one. She is currently legally blind after having 90% of the muscles extracted from her eyelid. When Lakshmi Tatma was born in 2005, she had 4 arms and 4 legs. She was in fact a conjoined twin. However, her twin didn't develop a head or a chest, causing the appearance of a child with 4 arms and 4 legs. She was named Lakshmi after the Hindu goddess of wealth who was depicted to have 4 arms. At an early age, she started to suffer from fevers, ulcers, and other complications. However, her parents could not afford to get her any of the surgeries she needed. During that time, Dr. Sharan Patel found Lakshmi and offered her help. Further analysis showed that Lakshmi and her twin each had 1 working kidney. The second kidney Lakshmi had was necrotic. Furthermore, the twin spine and abdomen was merged with Lakshmi's body. The doctors surmised that without surgery, Lakshmi would most not likely live to see her teenage years. Dr. Patel and 30 other surgeons formed a 27-hour surgery, working in 8-hour shifts to remove the dead organs, amputate her extra legs and arms, and fix her spinal column. The surgery was a success, and Lakshmi started to attend a school for kids with disability. In the future, further surgeries would be required to fix her club feet. Macie Hope was born to Chad and Carrie McCartney, but she was born twice. That's right, she really was born twice. During the 23rd week of pregnancy, Carrie took her family to the obstetrician to find out the sex of her baby. Unfortunately, the doctor informed her that a non-cancerous tumor was growing inside of her along with the baby. The tumor was the size of a grapefruit and almost the same size as Macie. It was killing her. The doctors informed her the only solution would be to remove it. During the surgery, 80% of the baby was extracted out of the womb, keeping just her head and upper body inside. There was a large risk the baby could go into cardiac arrest when she was exposed to the air outside, so doctors worked quickly and removed the tumor. Macie was then safely returned into the womb. It was a 4-hour procedure that was successful. On May 3rd, Macie was born again. A large scar remains on her backside from surgery, but the surgeons say it can be fixed when she's older. Narendra Kumar was 18 years old when he started to experience heavy nausea, weight loss, and pain. He was rushed to the hospital when doctors informed him that there was a mass growing inside of him that had hair, teeth, and even an umbilical cord-like structure. He was diagnosed with fetus in fetu, which is a developmental abnormality in which a mass of tissue resembling a fetus forms inside of the body. There are 2 theories about the origin concerning the fetus in fetu. The first is that during the development, one mass begins as a normal fetus but becomes enveloped inside its twin. The other is that it's a highly developed tumor with different tissues, such as hair, muscles, and bone. Narendra was informed that the parasite had grown inside of him since birth and that it was still growing inside of him due to metabolic activity of his body. After 3 hours successful surgery, the mass was removed from his body. It had hair, small childlike teeth, and a bony structure of chest and spine. Thank you so much for watching, and if you enjoyed, subscribe for more content.